right, and we are officially going. So, Dr. Cowling, thanks so much for coming on the AOCPMR Podcast. Really excited you're here to chat with us about CrossFit, nutrition, and a bunch of other things.
Awesome, man. Thanks for having me.
So, I just wanted a real brief. Can you talk to us about your journey into like medicine and PM&R? Like, what about PM&R clicked with you, and how did you end up where you are now?
Yeah, so I first was interested in musculoskeletal medicine, way back in like 2009. I was playing college football, getting injured a lot, and spending a ton of time around physical therapists. So I thought that would be a good route for me. I ended up actually ending my football career prematurely because I had a bunch of knee surgery. So I thought, okay, I'm going to go to physical therapy school. I transferred colleges to another place that had more solid, clinical science courses. And when I got there, I went to a lecture from an osteopathic physician because all their health club was all tied in together. And I thought, wow, this specialty, PM&R, seems really cool. And this guy's a DO as well. So I decided to apply to medical schools instead. And at that time, they just switched it. So you needed a doctoral degree to be a physical therapist. So it just kind of all fit together. Went to medical school at Michigan State, and there's a pretty strong PM&R presence there. So from there, started hanging out with the PM&R guys. They teach our physical exam courses, and kind of knew from the get-go that that's what I wanted to do.
Awesome. That's a great summary. And so you sort of advertise or bill yourself as a CrossFit physician, and I think everyone is sort of familiar with CrossFit, but for me, it seems like this thing that I keep revisiting. Like, I thought I knew what CrossFit was like 8 years ago. It was like where people slam their weights on the ground. I just kind of wrote it off. And then I saw that they were doing like handstand push-ups against the wall, and then I kind of wrote it off. And then I keep thinking I have it figured out, and it turns out there's always more to that culture than I think. And now it seems like it's like a whole lifestyle. They have the CrossFit Games. When I saw that, I was like, okay, so these guys are like really doing something bigger than just like, here's a couple weightlifting techniques. It's more than just like a weightlifting gym. So can you, like, in your own words, like what is CrossFit?
So I guess the definition of CrossFit is constantly varied high intensity functional movement. And that might seem a little bit confusing, but essentially it's mixing in different domains of fitness so that, the person who does CrossFit, for example, might not be the strongest person in the room, but they're going to be really strong. They might not be the best endurance athlete in the room, but they can run pretty good. So essentially, it's mixing our anaerobic and aerobic exercises, mixing up the intensity, the length, the duration, just to provide a constant stimulus to your body system. I like to describe CrossFit as more of a community, although everybody sees the fitness aspect like you touched on. Nutrition is a huge part, and the community aspect, teamwork, camaraderie, those are things that are really emphasized.
Awesome. Yeah, the community is something that, like, that's the palpable thing to me. When I know, like, any of my friends who do CrossFit, they have like this devotion to CrossFit, and I kind of feel like if I were to spend more time doing it, I'd probably get sucked into it too. It almost has like this like cult status. Does that make sense?
Yeah, and unfortunately, sometimes that can have a negative connotation associated with it. But I would definitely say that whenever you get into a situation where you're doing something extremely difficult with other people, you tend to like and relate to those other people. So
Right.
I tell people all the time before I started doing CrossFit, and in medical school, unfortunately, we have this culture of going out on the weekends or after exams, and you just want to just binge drink and kind of forget about, how terrible the exam was. Well, when you start hanging out with people that get up on Saturday morning and want to go kick their own ass in a workout, it becomes very difficult for you to show up to that hungover. So it kind of forces you to change your habits to fit in.
Yeah, I did do like a one trial session. Just like my friend was opening up a gym in the school that, like, in the city where my school is, and I did a WOD there. And my takeaway was just like, these guys and gals are just way, 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 way tougher than me. Like I've been, I wrestled in high school. I think I'm like relatively athletic. I work out and stuff, but never at that kind of intensity and for those durations. And going through that was just like agonizing. And so, but I think what you brought up about going through it as a group, it's sort of like that running a marathon when there's, it's hard to do that by yourself. But when you're in that big pool of people like that, you all push each other, and that must just feel like amazing to have like that group to go through that stuff together like that.
Absolutely. A lot of us haven't had anyone cheering us on, since high school or ever. And I remember, when I got back into working out really hard and doing CrossFit, we have a thing called the CrossFit Open. It's kind of a worldwide competition. And the first time you get that really hard movement, like you're saying, you come into a CrossFit gym and you see somebody do a muscle up and you think, oh my God, I could never do that. Yeah. And then after a few months of doing CrossFit, or maybe a year or maybe 2 years or however long it takes you, when you get that first bar muscle up and everybody's cheering and going crazy, it just brings you back to that. And you're so happy that you achieved that. And people joke around that CrossFit is like gym class for adults. And it's kind of true. I mean, it's just really fun to get out there and try new things and have people cheering you on for it. So,
well, and I think it's hard to work out by yourself. Like, you definitely can do that. You can motivate yourself, but it's not the same when you have like a workout partner or something. And so I imagine having like a team setting, it's that same thing, but even more amplified, where it's everyone pushing each other like that. That just seems like a great way to keep yourself like accountable and working as hard as you can every day. Because when I just go in, go to the weight room or something, I feel like I can tap out at any time. And often I do, because there's no one, it's all on me, and I can let myself down. But if I have like a friend who's like, come on, we said we'd do this. So to me, that seems like a huge benefit of it. So as a CrossFit physician, you did say I saw on one of your Instagram posts, you did the MDL One course. Can you talk a little bit about that? I read some headlines really of articles from CrossFit is sort of bringing like physicians into their own network. What is that program, and what is the purpose of that?
So the MDL One, there's a level 1, 2, 3. There's tiered system of becoming a CrossFit coach or getting certified in CrossFit. And the L1 is just the basics of CrossFit, talking about the CrossFit diet prescription in terms of nutrition and exercise and the CrossFit methodology and why that works. The L1 was targeted, the MDL1 was targeted at bringing physicians in and just providing education for them as one part of, what CrossFit is and why it can work and help to prevent chronic disease. And the other big goal is to bring physicians together, like you mentioned, as a network, so we can all work together to kind of get the message out there of, primary prevention, which is a huge problem with our medical system, is that we're too focused on intervention.
Okay, yeah, that totally makes sense to me. So it seems like the MDL One program and beyond, it's more of like networking as physicians to sort of like spread the health benefits of CrossFit and nutrition, but it's not necessarily like treating CrossFit injuries like that. That's not really like the focus of it. Is that correct?
Yeah, that's correct. So a big part of CrossFit that people miss, unfortunately, because the CrossFit Games are cool and everything, and seeing these people perform these amazing feats of athleticism is cool, but CrossFit has always been a health-based company, and from the get-go, their goal has been to cure chronic disease through prevention.
Okay, that's great. There's always more depth to this than I ever realized. Every time I learn more about CrossFit, there's always like more about it that I never realized was there. So about the CrossFit Games, I did see that actually is in Madison, and you are at PGY 3, is that correct?
Yep.
At the University of Wisconsin-Madison. So was that's you being a very CrossFit centric guy, was that part of the motivation to go to that residency program or rank it higher, or was that just kind of a serendipitous thing? It worked out real nice.
It actually worked out amazing. I did not know. At the time that I matched here, I was actually applying to be on the CrossFit Games medical team as a volunteer. And I completed my intern year down in Indianapolis at IU. So when I was down there, that's when I found out the games were going to be in Madison. So it just kind of worked out perfectly. And I actually, when I applied on the Games medical team, wasn't even doing CrossFit. It was, when I got down there and met everyone and learned what CrossFit really was myself, that I fell in love with it. But it's been really nice having the games here. Unfortunately, we won't be holding them this year because of everything that's going on.
Right.
But for the last 2 years, and I mean last year, like I tell everyone, it was the best week of my life having the games here.
Oh, that sounds awesome. So just as a total outsider, I just don't know, like the competitors at the CrossFit Games, are these just like world ranked the best of the best of the best? Or if I started doing CrossFit, could I go and get eliminated first round next year? Do you know what I mean? Is it something for like everyone, or is it something for these elite super athletes only?
So the way that you qualify for the CrossFit Games is an ever-changing process, and it was different last year than it will be this year with everything, and different the year before that. So essentially, there are multiple ways to qualify for the CrossFit Games. We do the Worldwide Open competition, like I stated earlier, and they take the top members from that, and then those people get a spot. And now they also have these things called sanctionals, which are huge CrossFit competitions that could be in in Europe, or they'll be in South America, or in the United States, and they'll take the top finishers from those as well. And then last year we took the top winner from every country. So to make a long story short, though, these people are elite athletes, and the chance of an average person just starting to do CrossFit and making it to the games, it's insanely hard.
Okay, I'll write that off. I won't plan on that then. I wanted to switch gears a little bit to nutrition. This is something that you also do. What is your role? You are a nutritionist for a CrossFit gym, is that correct?
I would use the term nutrition coach. Yeah,
nutrition coach.
I run a nutrition program at one of the local gyms here, the Big Dane Collective. And basically my goal with the program is just to provide nutrition education for the members. We do like a monthly newsletter and nutrition challenges throughout the year aimed at keeping everybody as healthy as we possibly can. There's so many misconceptions and different opinions and bias in the nutrition world that I think it's very difficult for the average person to try and navigate that.
That's how I feel, even with the minimal medical school training we had in our preclinical years. It was maybe like a lecture on nutrition and we were done. But every time I know that nutrition is like the secret ingredient to, having like a really cut physique or just getting your fitness goals. Every time I try to like dip into the world of nutrition, I'm just overwhelmed that there's all these different philosophies and they're warring and I don't know who's right. And I start trying to count my macros on my phone and I stop doing it in 2 days because it's just, it seems so hard to do it. And is it that hard? Is it a matter of discipline? And I just like the average person needs to just buckle up and start doing these things? Or is there like an easier way to approach nutrition? Because every time I try to look into it, I just have to tap out after a week tops. I just can't hang. There's too much to keep track of, How do you get in as a rookie like me?
So that's a great point. I first got into nutrition when I quit playing football and I just felt like I was too heavy and wanted to lose weight to take pressure off my knee. And I stopped. I was a defensive end. So I had a good amount of weight to cut. And I think the big part first is just education, because the most important thing is the diet that you choose needs to be sustainable for you. So a lot of people will dive into counting calories and counting macros before they ever focus on their food quality. And one thing that I tell people all the time, because we all come from different backgrounds, we've all been exposed to different nutrition, propaganda, if you will, is that, whether you're on a vegan diet or whether you're on a carnivore diet or a paleo diet or a ketogenic diet, the best thing that you can do to start out is just focus on your food quality and eat more unprocessed foods, So don't be eating processed meats, don't be eating, and chips and things that are packaged. And by doing that alone, focusing on, meat, vegetables, nuts and seeds, things that come from the ground, that and alone is a big enough step to help most people just take that jump,
Yeah, that makes sense. So as a resident, you're obviously extremely busy, and as a med school to a much lesser degree, especially right now, I'm also very busy. It's hard to like keep all this stuff in track. And you've documented some of your own like fitness fluctuations throughout residency and stuff. How, as a busy resident or a fellow or someone who is just working like ungodly hours every week, do you have any tips on like how to keep that under control or in track? Like what's your experience with that?
Yeah, so I think the first thing to realize is that, nobody's perfect on what we're doing. And for us in medicine, we've chosen a lifestyle that requires a great deal of responsibility in us being able to show up and focus on patient care. And so for me, I've had my own fluctuations in weight, whether you're on an ICU rotation where you're working, 80-hour grinding days. And then you could be on an outpatient rotation where you're just in clinic from, 9 to 5 every day. So understanding that, knowing when you're going to be busy and being able to prepare for that. Okay, so I may have a half an hour each day to work out. So I need to just have my equipment, or I need to get up in the morning and I just need to knock that workout out, or I need to prepare my meals in advance. It's just trying to plan, and then making sure that, at a minimum, I tell myself I have to get 5 workouts in per week, no matter what. And I've been able to stick with that, but that's just kind of a rule that I set for myself. And you can't out-train a poor diet, unfortunately. So, you can still put on weight when you're working out. So just being able to manage your diet the best that you can, or, doing meal prep ahead of time, or finding a company that can deliver food to your house, like Instacart. That's really big. You can, get your meals and they'll have them delivered, and the small difference in price there will pay off big time in the end. So just things like that, planning ahead is probably the biggest thing.
And I've heard on other podcast interviews that you've given, you emphasize the importance of mindfulness meditation, and it just seems like that fits very nicely in with the rest of like the holistic approach to your wellness. Can you talk a little bit about mindfulness meditation and how it's changed you as a CrossFitter, as a physician, and anything else important to you in your life?
Yeah, it's great that you mentioned that. So I first started getting into meditation when I got accepted to medical school. That year, I had a lot of just anxiety out of nowhere. I couldn't figure out where it was, coming from, and I was going to the doctor and trying to figure it out, and ended up reading this book called Mindfulness in Plain English, which I thought was an amazing book. And that really helped me to troubleshoot. I started meditating 20 minutes a day, and within a few months, noticed complete reversal of symptoms that I had. I just started to feel a lot more calm, and I turned it into almost a daily practice after that. And I think the benefit of it is just that, we all have these thoughts and things that come up, whether I'm doing a workout and I'm like, oh my God, this hurts my body so bad, I need to stop. Or whether I'm trying to focus on a patient who may be in a bad position and my mind is wandering, but they need care. So just understanding that, okay, these thoughts are going to come up, but you don't have to succumb to them, and you don't have to get involved in it. You can just sit there and observe what's going on in your mind and not become attached to it. And now, fortunately, we have apps like Headspace and Calm, and these apps are just amazing at being able to self-teach us some of these techniques.
I've been curious about those apps. I've seen the ads for them. Is it just like they guided meditation? They just, a soothing voice tells you what to do and where to visualize and stuff like that?
Yeah, so I think a big thing for people, if you're trying to just meditate and you just sit down and try to focus, you're going to, just think, I can never do this, I can never do this. But then realizing it's the struggle of saying that I can never do this, and then just sitting there, that's going to make you better at meditating, because that's what meditating is. And these apps just provide troubleshooting for that and help you to understand what to do. And I mean, I've been using Headspace for like 6 years now, and they have different courses on there. Like you can go through courses for anxiety, depression, procrastination, anything you can think of, sleep, they have a course for. So they kind of use mindfulness combined with some cognitive behavioral therapy to help you troubleshoot what might be going on.
Awesome. Switching gears again, back to like PM&R. What in PM&R excites you like in the field? I've heard you talk about regenerative medicine. Is there anything else? What about regenerative medicine do you like, and what do you see like your future in PM&R? Like, are you planning on doing a sports medicine fellowship to focus more on like incorporating it into like CrossFit? What are your goals within PM&R?
So I think that one thing that really, brought me into PM&R, and one thing that I really enjoy now, is the multidisciplinary approach that we can use. I'm actually interviewing right now for interventional pain fellowships or pain medicine fellowships. And I think the coolest thing about pain medicine is that, first of all, we get to use our MSK exam, the physical exam. So using our physical exam to be able to diagnose patients, and then taking what patients are saying, these subjective complaints that we used to not be able to treat, and now we can use imaging modalities like fluoroscopy and ultrasound to find objective, measures to treat. And then there we can deliver a medicine, whether that be PRP, stem cells, corticosteroid, whatever we think is appropriate. At the same time, we can use pain medicine to focus on lifestyle intervention. So we know there's a huge link between weight and the amount of pain that they're feeling, depression and pain. So getting them plugged into mindfulness-based cognitive therapies, getting them to lose weight, clean up their nutrition. It's a field where we can use this approach. And then all this stuff will help them to restore their function.
Awesome. And this is my own naivete. When you're looking at these interventional fellowships, I know there is pain medicine, and I know that they're ACGME accredited. And there's also like these sports and spine fellowships that they're not accredited currently, but maybe they will be later. When you're considering these different sort of like interventional, they're both seem like a lot of overlap where they're intervening on like the spine in particular for pain. What goes through your mind when you consider these two options?
Yeah, choosing whether you should do a sports and spine versus ACGME pain. To me, the deciding factor comes down to the accreditation, and then where I think that I might end up going to an ACGME accredited fellowship. I think for one protects you because there's an educational aspect that we all need to get for the board exams, and that's guaranteed to be built into those programs. And then secondly, it makes you more marketable when you're looking at applying for jobs for places, whether you want to stay in academic medicine or go private. So that's why I put my focus mainly on ACGME pain.
Okay, great. And I wanted to ask you also about your experience through this COVID pandemic. What has this looked like as a resident at the University of Wisconsin-Madison? Are you just seeing COVID patients all day? Or are you seeing no COVID patients? Has it changed what you do day to day, or is it pretty much business as usual? How has that looked for you?
So yeah, at the University of Wisconsin, we do 3-month rotations, and then we take call at a 50-bed standalone rehab hospital on the east side of Madison. And if you're on our inpatient service, for the most part, it's been business as usual. For our outpatient rotations, still until the 26th of May, we're doing mainly phone visits or video visits with patients. So if you're off of the inpatient service, you're doing phone stuff and then didactic type stuff. Now, though, it's interesting. We're starting to take COVID patients for rehab. So, patients that have had COVID, had a prolonged ICU stay, and now they have debility, are just having trouble getting their function back, and working with them, which is a pretty interesting and rewarding experience as well.
Awesome. Can you talk about any advice you would give to a medical student interested in matching into PM&R, or maybe someone with similar goals and ambitions? What would you have done differently in medical school? How can someone kind of get into a position where like you are now?
So I think it's interesting because PM&R, I think when I was coming up, I was very involved with the national organizations, AOCPMR, and doing as much research and things like that as I could, because the specialty is just becoming increasingly competitive. I'm sure you guys know this. Mm-hmm. Every year it gets tougher and tougher. I think just staying focused on rehab as a specialty and why you want to do it, doing things that show interest in rehab, covering sporting events, adaptive events, working with patients with TBI and spinal cord injury, and just volunteering your time in places like that can make a huge difference at showing why you want to do this specialty. And I think that's one thing that separates certain candidates out from others. If you can show specific things while you're in medical school that have to do with restoring function to patients, because that's what PM&R is all about, right? Those are the things that people are going to like when you interview.
Great. And I always like to ask this because I'm an osteopathic fellow at my school. And do you use OMT in your day-to-day practice? Does that have an impact on your patients? Do you not use it? Obviously, most people don't use OMT. I'm just curious, do you have a take on that?
Yeah, so I use OMT a decent amount, probably on my friends more than anything, or people who are like, oh, I kinked my neck doing this, or I hurt, I tweaked my back doing this. I carried a table with me for the longest time. Now I keep my table tucked away and just pull it out when I need it. But here at Wisconsin, we have had 2 residents while I've been here that have done the Osteopathic Manipulation Fellowship. I'm not sure do you know exactly what it's called?
NMM, like neuromuscular medicine.
Yeah. And so when they come here, they're like really good at OMT. And they'll provide didactics for us on Friday mornings about how to go through the OMT. The biggest takeaway that I would say from going to an osteopathic medical school is your musculoskeletal knowledge and just knowing where structures are, being able to palpate the PSIS, the SI joint, the spinous process, transverse process. You're just so comfortable doing it compared to everybody else. And when it comes to even doing procedures and stuff, finding your landmarks is so easy. So that's one huge thing that I think. Going to an osteopathic school is ideal for PM&R specialty.
Awesome. Yeah, we love to hear that. We love to hear any way we can fit it in and see how it's impacted your career in a positive way. So that's awesome. That's really all the questions I had for you. Is there anything else you'd like to leave with our listeners, an audience of mostly medical students? Any parting advice or any wisdom on CrossFit, fitness, nutrition? Anything that you think should be emphasized more than anything else?
Yeah, first of all, I think, if you guys ever have any questions, you can reach out to me. Find me on Instagram. It's Cowling _. But I think the big thing that I would have everybody take away is, in order to take care of patients, you have to take care of yourself. And we didn't get into a field to destroy our own health, right? So just thinking about ways that you can keep yourself healthy for the long run is the most important before you can care for other patients.
Awesome. Thank you so much. I'm really glad you're able to come on and chat with us for a little bit.
Thanks, Jake.